Now what, Mrs. Gibbs? Not again. Just what I need. Get up.
Oh, you're hurting me.
It's your own fault. Always wetting the bed.
Mr. Thomas, it's time for you to take your medicine.
Can it wait a minute? This program's almost over.
I'm really busy. I have a lot of things I need.
I said just a minute.
No, you don't seem to understand me. I need you to take this. Here, just take it right now. Why do you always have to give me such a hard time? Can't you just be a good little boy?
You've just seen 3 instances of elder abuse. Not very pretty, is it? Unfortunately, it's happening more and more every day. It's estimated hundreds of thousands of elders are abused each year. Our picture of elder abuse is limited due to the hidden and complex nature of the problem and the failure of healthcare workers and others to report elder abuse consistently. More disturbingly, the number of victims is expected to rise as the population ages.
Elder abuse can strike any healthcare facility, including long-term care centers, hospitals, and outpatient care facilities. In addition to abuse, neglect can also threaten the well-being of the elderly. It can be hard to spot the more subtle forms of neglect and abuse. They're often unrecognized because victims tend to be isolated. In fact, you may be one of the only objective observers who sees these elders over time. So you may be one of the only ones who can break the cycle of abuse and neglect. How? By learning to recognize elder abuse and neglect, by learning how to respond to these cases, and by committing yourself to safeguarding the elders in your care. The American Medical Association defines elder abuse and neglect as mistreatment of an elderly person that may include physical, psychological, or financial abuse or neglect. It may or may not be intentional, and an older adult will often suffer several forms of abuse and neglect at the same time. Physical abuse is an act that results in bodily harm, injury, impairment, or disease. It usually takes the form of hitting, slapping, pushing, punching, pinching, burning, or striking with objects. It may also include sexual coercion or assault, incorrect positioning of the elder, forced feeding, and improper use of physical restraints. Physical abuse is the most obvious form of abuse because it often leaves behind telltale physical signs. Some forms of physical abuse are hard to spot. Did you know it's physically abusive to rush an elder, pulling him or her too fast when helping them walk? Well, it is. It's also physical abuse to tie a wandering patient or resident to a chair because you don't want the patient to get lost while you're busy. Giving a patient too much or too little medication can be physical abuse as well. It is never acceptable to use chemical or physical restraint for discipline or convenience.
It's 5 minutes until I get off, and now I have to...
Psychological abuse inflicts emotional pain or distress on its victims. It comprises verbal scolding, harassment, or intimidation, threatening punishment or deprivation, treating the victim like a child or infant, or isolating the elder from family, friends, or activities. It often goes hand in hand with physical abuse. When it doesn't, it's harder to spot unless you witness it. Generally, the victim's demeanor and behavior offer clues. Depression, fear, hopelessness, withdrawal, or isolation can signal psychological abuse. You may not recognize some of the more subtle forms of psychological abuse, such as taking something away from a patient or resident when you're angry, scolding someone in front of others when she's done something embarrassing, like soiled her pants, or isolating someone. These acts create an environment where the person may feel shame, insecurity, or a lack of control, and can be psychologically damaging. Financial abuse occurs when people take control of elders' resources through misrepresentation, coercion, or outright theft for their own gain. Financial abuse may include stealing money or possessions, forcing the elder to sign contracts or assign durable powers of attorney to someone, or charging the older adult for unnecessary services or services never rendered. Financial abuse can be difficult to identify because often there are no obvious indicators, and the victim may be unaware it's happening. While abuse describes actions, neglect refers to omissions. Neglect occurs when an older adult suffers from a lack of attention to his or her person or environment. At its worst, the victim's physical and mental health can be at risk. Physical neglect involves failure to provide goods and services necessary for the health and well-being of the elder. Physical neglect may include withholding adequate meals or hydration, physical therapy or hygiene, as well as failure to provide physical aids, such as hearing aids, glasses, and false teeth, or failure to provide safety precautions, such as night lights or safety bars. Stop and think for a moment about call buttons. You're neglecting elders if you take your time answering a call bell, if you move the button out of reach, or if you unplug it, even if the patient or resident uses the call button inappropriately sometimes. You're also physically neglecting someone if you leave that person on the toilet for an extended time, even if you just forgot. What if you remove someone's cane or walker from the side of the bed? This is neglect, if it keeps the person from getting around. It's also physical neglect if you mark the chart that the person was repositioned in bed as ordered in the plan of care, then fail to do so. Psychological neglect is failure to provide social stimulation. That may mean leaving the older person alone for long periods of time, ignoring him, or giving him the silent treatment, or failing to provide companionship, changes in routine, or links to the outside world. Financial neglect consists of failure to use available resources to sustain or restore the health and security of the older adult. Signs may include a family seeking care that does not meet the senior's needs, even though the money is available to provide the proper level of care, an elder's confusion about her financial situation, or a sudden transfer of assets. Another issue involves violation of patient or resident rights. In other words, a caretaker ignores the older person's rights and abilities to make decisions. Rights violations may include denying the elder a right to privacy, not allowing the elder to make decisions about health care or personal issues, or treating the person disrespectfully.
Certainly, we've all known seniors who are alert, full of life, and independent despite advancing age. Most elders, even many who are abused, are mentally sound and mobile. And then there are others, the ones who are physically frail or whose minds are not quite as sharp as they once were. They're usually more dependent on others, putting them at greater risk.
Abuse and neglect can also arise from misunderstanding or ignorance. Sometimes people feel frustrated with the elderly because they don't really understand the effects of aging. They fail to give elders the extra time they may need to process information, respond to questions, or perform tasks. Those people may not mean to abuse anyone, but they do.
So, which elders are at greatest risk of abuse? Research indicates older adults from all walks of life can be victims. Men and women from all racial, ethnic, and economic groups.
We know from research, such as the National Elder Abuse Incidence Study, that more than half of the reported elder abuse victims are women, possibly because they often live longer than men. Among these reported cases, elders aged 80 and older, and those with physical or mental impairments, are more likely to be abused than others. Remember, any elder may fall victim to abuse. Consider this. Many seniors are relatively isolated from society, with little, if any, outside support. They're frequently dependent on their abusers and are reluctant, even too embarrassed, to complain. Also, victims may have mixed feelings about their abusers. Those conflicting feelings make it difficult for them to consider removing themselves from the abuser's grasp.
So, who are the abusers? They're family members, caregivers, strangers, men and women. In more than half of reported cases, the abusers are male, according to the National Center on Elder Abuse. Outside healthcare facilities, family members are most often the abusers. Family and loved ones may continue abusing elders even after the person has entered a long-term care facility or a hospital.
You should keep careful records if any patient or resident develops injuries routinely after a visit from a certain family member. This may reveal a pattern of abuse you need to assess. Strangers can also be abusers, particularly in instances of assault or financial abuse. Be on the lookout for con artists or anyone who appears out of place in or around the facility. Report suspicious activity to security or to your manager. In healthcare facilities, anyone can be an abuser. In one study, 40% of the healthcare staff who participated admitted committing psychological abuse in the preceding year, while 10% admitted physically abusing residents. Bottom line, you need to watch the activities of all people with access to the elders in your care. Several risk factors have been identified as contributors to abuse and neglect. Of special importance is the caregiver's pattern of dealing with stress. Caregivers with an abusive history may continue that behavior at work. Some caregivers, particularly those with little or no formal training or support, can be overwhelmed by the strain of caring for a dependent elder. Even more stressful, some seniors are abusive to their caregivers. They may have Alzheimer's disease and so lack self-control. It's important to step away from the patient or resident if you feel angry or extremely frustrated. Return only after you've calmed down. At the same time, be alert for unresolved conflicts between family members, an elder's history of abusive relationships, and mental illness, alcoholism, or drug abuse in elders or caregivers. All signal the potential for abuse and neglect. Finally, inadequate building and ground security can leave an elder vulnerable to abuse from strangers. Whatever the cause, elder abuse and neglect are never acceptable.
What happened to your forehead, Mr. Ames? Did you fall? Well, who's been in your room lately?
My family, nurses, my doctor.
How did Mr. Ames get injured? Did he trip and fall or pass out and hit his head? Or was he abused? When should you suspect abuse? Many times the possible victim can't or won't help you uncover the truth. So what can you do? You need to be aware of the common warning signs of abuse and neglect and be on the lookout for them.
Let's look again at some common warning signs. There's cause for suspicion when injuries, as described, are inconsistent with medical findings, or if the elder and caregiver give contradictory accounts. Physical evidence may include bruises, welts, lacerations, fractures, burns, rope or restraint marks. Notice if the injuries are in various stages of healing, because this can indicate ongoing abuse. Genital injuries may be symptomatic of sexual abuse. If possible, someone should review laboratory results, which may reveal over or under medicating or unexplained venereal disease. Telltale signs of neglect are dehydration, malnutrition, decubitus ulcers, poor personal hygiene, or lack of compliance with medical regimes. Psychological abuse or neglect is signaled by extreme withdrawal, depression or agitation, infantile behavior, and indifference toward others. Financial abuse or neglect should be considered if the patient appears to be receiving an inadequate level of care despite adequate financial resources, if the elder seems vague about his or her finances, or has suddenly transferred assets or control of them to someone else.
Excuse me. Could you please trim my hair today? I mean, it really needs...
Look, stop bugging me. Every time I walk by your door, you ask me to cut your hair. I don't have time. There are other people in front of you, so leave me alone and I'll get to it when I'm good and ready.
The healthcare worker you just saw witnessed psychological abuse. This needs to be documented and further investigated. A report should be written detailing victim and witness statements. Be sure all parties sign this report, then notify your manager or your state's reporting agency so a thorough investigation can begin.
Anytime you suspect abuse or neglect, you must take action. It's your ethical and legal responsibility. You must follow your facility's assessment and reporting policies, which are designed to protect elders. When necessary, the proper authorities will conduct a complete investigation. Here are some general guidelines. You need to intervene immediately when you see abuse or neglect, even if you just suspect it. Your primary concern is to protect the victim. Take immediate steps to ensure the elder's safety. It's critical the incident is recorded accurately. The sooner it's documented, the more reliable the information. The elder should be assessed without the suspected abuser present. Questions should be direct, but not threatening or judgmental. The interviewer should encourage the suspected victim to talk about the situation, including their relationship with the person who may be the abuser. The elder should be asked directly if someone hurt them, or threatened them, or took anything without asking, and who it was. Then, roommates, caregivers, and anyone who may have seen what happened are interviewed, and it's noted if there are any differences between what the elder reports and what the others are saying. All interviews must be documented. The medical history is an important tool. When, where, and how did any injuries occur? Are there any inconsistencies between descriptions of events and physical evidence? Physical evidence is also collected, not just in writing, but with photographs, to indicate size, placement, and severity of injuries. Bruises alone do not confirm abuse, as elderly people often have frail, thin skin, which bruises or tears easily. Accurate, detailed, and objective records are crucial. Patients' exact words in quotations should be noted. You must report the suspected abuse either to the designated person in your facility or directly to an appropriate agency. Every state has an Office of Protective Services to guide you. Remember, you may be required by state law to report suspected elder abuse. Failure to report can result in a claim of negligence.
What are you doing?
I'm giving Miss Toms her bath. I mean, she's so heavy, I just sponge her off where I can.
Yeah, but you really can't be cleaning her that way.
I'm not Hercules. I'm not going to kill myself. Look at her size and look at me. I don't think so. Mom's the word, okay?
What would you do? Keep the secret or tell the supervisor? In this case, the nurse told her boss, and it's a good thing too, because in giving Mrs. Toms a thorough bath, they found areas where the skin was beginning to break down, a potential disaster for this diabetic lady. Because the nurse acted on her suspicions, appropriate skin care was instituted immediately. This is why it's so important for you to report suspected abuse or neglect. You may be the mistreated elder's only chance for help.
Remember, elder abuse or neglect is a common problem, a problem you're likely to encounter. Be alert for signs of abuse or neglect. Document what you come across and report any suspicions. Do your part to bring this hidden problem into the open. Show your concern. Become an advocate for the elders in your care.